Hello everyone and welcome to our town hall here today at September 27th. Today's town hall is focused on human resources and specifically benefits. It is sponsored by Penn State Today and the University Staff Advisory Council. Thank you all so much for joining us today. I just want to remind you a couple of things. You can submit questions during the live event. You can, if you have a piece of paper, or if you haven't got one, please see one of the people walking up and down the halls. They will hand you one, you can fill it out, and it will be kept anonymous. You can pass it to the ends of the rows, and they will be filtered in to be asked in the queue. Also, you can ask questions via questions@psu.edu. And again, they will be kept anonymous. We have received many questions already ahead of time, so thank you to everyone who had submitted those in advance. I also wanted to let you know that this town hall will be streamed at liveevents.psu.edu. It will also be archived there if you want to go back and watch any parts that you just loved so much that you need to see them again. And it will be a couple of days before that happens because we are going to close caption it so that it will be completely in compliance. Also, we'd like to direct your attention, once you have completed today's town hall, we'd invite you to take the survey also at liveevents.psu.edu. That's really how you can tell us how we can do this better and what topics you'd like to see covered and anything that we could improve upon. So you'll help us bring a better product to everyone. So again, I'd like to remind you, questions at psu.edu or the paper copies, and people will come down the hallways and collect them. First, now I would like to introduce Nick Jones, our Executive Vice President and Provost, and David Gray, our Vice President for Finance and Business. I understand you guys would like to say a few words first.
Sure, thanks. Good afternoon, everyone. Thanks for being here, and thank you to those who are joining us by live stream. I have found in the past that sometimes I'll be visiting campuses in the week or so after a town hall and find out that there's actually pretty significant participation from the campuses. So hello to everyone who's out there. It's great to have you here. I'm going to be a little bit more formal in my introduction than normal because there's actually a pretty important message that I want to convey to the community. But so please bear with me. So first, I'll just begin by saying we know this is a time of much change. This is something that comes up as a theme, I think, in all of our town halls. And we know the stress that all that change brings. David and I actually were at a meeting this morning that consisted primarily of new executives and university administrators. And I think I caught David's eyes as I walked into the meeting. Even we were taken aback in that meeting, just executives and administrators, by the number of people in the room. And we know that this is playing out across the institution after the VRP, just in the normal course of events, but certainly with the VRP. And when you add to that the rollout of new enterprise systems and many changes in the way we do business, we know that it's a lot. But beyond this stress that comes from that change, as Provost, I do want to take a few minutes to speak just generally to the current climate in our nation, which is impacting us all additionally and in different ways. These are trying times on any university campus, as concerns about inclusion and the creation of a welcoming environment clash with vitriol and prejudice that some groups or individuals intentionally bring to our campus. Public universities like Penn State are and must always remain committed to free speech and expression. We are obligated to follow federal law and to support our Constitution. And of course, as a university, we encourage free speech to be expressed in thoughtful and respectful ways, even when the university strongly disagrees with the opinions being expressed. This is exactly why hate groups and others have turned to universities and colleges as a place to spread racist, misogynistic, anti-Semitic, homophobic messages. They know we value diversity, and they know we value free speech. While hateful words may be protected speech, they have a powerful negative impact on our educational community and its members, and they can create tensions and fear. We recognize this not just today, but any time an incident is reported. Just last week, flyers promoting a white supremacist group surfaced on public bulletin boards on the University Park campus. The organization that posted the flyers is not a recognized Penn State organization and is known to have targeted dozens of universities worldwide or nationwide. The posters that promoted the white supremacist organization were designed to provoke anger and divisiveness and to intimidate. I want to take this opportunity to say unequivocally that Penn State and its leadership denounce the reprehensible and abhorrent rhetoric from these groups and the individuals that they represent. I find them repulsive, both personally and professionally. And make no mistake, as a university that fosters diversity, inclusion, and equity, Penn State condemns bigotry and hateful and racist language or activity of any kind. We consider these groups and the actions that they take as counter to our institutional values, and while we cannot censure them, we can condemn their hateful speech. Diversity and inclusion are integral parts of Penn State's identity and will remain so. They represent an unwavering commitment to equity and fairness that repugnant efforts by white supremacists or anyone else can neither diminish nor denigrate. Penn State has long been a leader in promoting an inclusionary climate with an abundance of rich and rewarding experience for faculty, staff, and students from all walks of life. This will not change, no matter what challenges come our way. Thank you for listening. David.
Good afternoon, everyone. I want to echo Nick's sentiments and underscore once again Penn State's steadfast commitment to maintaining an open and welcoming environment for students, faculty, and staff from all walks of life. As part of that commitment, I want to remind everyone of not only our ongoing All-In initiative in which we urge everyone to become involved, but also the numerous programs we have in place to increase diversity in our workforce. As part of those initiatives, I'd like to introduce Sarah Oliver Carter, our Senior Director of Talent, Diversity, and Inclusion, who came on board with us in March. Some of you, hopefully, have already gotten to meet her. Sarah, will you please stand and give a wave to the folks? Sarah serves on the leadership team for Human Resources, and in her position, she's helping us to attract and retain high-quality talent through innovative diversity and inclusion programming, and she's helping us in a very, very critical way to identify new methods through which we can recruit and retain a diverse workforce. Thank you, Sarah. I want to open up this town hall with some short updates to let you know some of what's happening across the university. Right now, as I think most of you are aware, painfully aware, we're in the midst of a budget impasse at the state level that has not allowed Penn State to receive its appropriation from the Commonwealth. We're now virtually a full quarter into our fiscal year, and it's 3 months after the Pennsylvania budget deadline has passed. Legislators in Harrisburg have not yet finalized the Commonwealth's budget, and we await word on the funding that is crucial to our operations. Please note that the university has adequate cash flows to meet our payroll and other obligations. Is that right, Joe Donchez? He's nodding his head. Thank you, Joe. While the absence of our appropriation is a critical concern, and I want to emphasize it is a critical concern, and I hope that you've all had the chance to see President Barron's call to the university community to contact state legislators. The university continues to function. On a more positive note, and on the federal side of things, and that seems a little bit ironic because you usually don't juxtapose positive and federal in the same sentence, but our faculty have done an outstanding job of attracting research dollars for another record-breaking year of $863 million in research funding. About $534 million of that is in federal money. That's outstanding news. Congratulations to our faculty on another record-setting year. The 2018 benefits open enrollment period will begin November 1st through November 17th, and employees can visit openenrollment.psu.edu to access the tools and assistance to make your benefits elections for the 2018 calendar year. The schedule of on-campus meetings and webinars is also to be found on the microsite. In late-breaking news from just a couple of weeks ago, our Board of Trustees has approved the university's 5-year, $4.7 billion capital plan that will commence next July. This capital plan will help us tackle the university's large maintenance backlog and provide critical improvements to instructional space at campuses across Pennsylvania. On the University Park campus alone, 65% of education and general buildings are more than 25 years old, and 40% are more than 50 years old. Older buildings were not designed to accommodate 21st century needs, and so you will begin to see improvements to many of our facilities in the coming months and years, particularly those that support academic programs. We realize that there are a number of changes occurring, and this might be a source of frustration and angst for some. We apologize for those inconveniences as we work to become better and more effective. We're updating many business service systems and bringing them into the 21st century. An added bonus is the cost savings that we're also capturing along the way. One example is the HR transformation occurring across Penn State. It's rolling out smoothly thus far with a lot of communication, and it's expected that we'll eventually save money through improved efficiencies in service delivery and enhanced and more effective systems. The IT transformation is also underway and is expected to lower costs by around $5.7 million over a 5-year period. In addition, the switch to Aetna on January 1st as the third-party administrator for our university's medical benefits and CVS Caremark for our prescription benefits program is expected to save our employees over $5 million and the university more than $70 million over the next 3 years. These are just some of the high points at Penn State, and without further ado, let's get to your questions.
Thank you both for coming here to speak with us today. And once again, I'd like to ask you all to submit your questions at psu.edu, or via paper pass them down to the ends of the hallways. First off, a really basic question that we've received in various forms. Can you just tell us what is changing in regard to the third-party administration and prescription benefits?
Okay, so effective January 1st, we will transition from our third-party administrator for our health plans from Highmark to Aetna, and from Highmark and Express Scripts for pharmacy benefit program to CVS Caremark. So this is part of a competitive bid process. We are terminating or ending a 10-year contractual relationship with Highmark and migrating to Aetna and CVS Caremark for the administration of those important programs. We think as a general practice in the university, not just with respect to employee benefits, it's very important that periodically we subject those major service relationships to competition. So we did that in this instance. There was an open RFP, we solicited proposals, and the verdict was very, very clear in this instance that Aetna and CVS Caremark were the most responsive in terms of both the quality and effectiveness of their programs, as well as the cost savings that we'll enjoy both at the university and also our employees will appreciate the benefits of.
David, can I just jump in?
Sure.
We've had a 10-year run with Highmark, right, which is actually, my understanding, reasonably unusual.
It's unusual.
For a contract to be that long. So many of you have gotten used to having Highmark for as long, perhaps, as you've been here. But I think this probably was an unusual happenstance compared to standard practice.
It is. 10 years is an unusual length of time for a service contract of that nature. The contract term with Aetna will be 3 years with the possibility of annual renewals. But we think that is much more actually effective for the university and will enable us as the customer to maintain some appropriate leverage over that contractual relationship to the benefit of everyone.
And what was it about Aetna that made it a better option than Highmark?
Well, I think if you look at the opportunity for both the university and our employees collectively to expect $75 million in aggregate savings over the initial three-year term of the contract, when we have been dealing with incredible cost inflation in our healthcare program. We've been over the last 5 years, the inflation rate in our health plans has been around 8% a year, with spikes as high as 14.7%. That's just not something that the university's budget can withstand when we're trying to do all we can to maintain access and affordability with respect to the tuition rates for our students. So this change will help us to really keep a lid on costs of offering our health benefits programs. But I also want to stress the fact that there were qualitative dimensions involved in that review of proposals that were submitted. And we also feel that Aetna and CVS Caremark will offer very responsive, effective services to our employees and their dependents.
It's probably worth emphasizing, too, that Penn State remains self-insured. This is the third-party administrator. And so now Penn State will be working with Aetna to manage the delivery of healthcare benefits to all of our employees. And I think, to put it in a nutshell, the determination was made that that Aetna at this time is a better partner for Penn State in managing this resource.
That's right.
In addition to being a better deal, many people are wondering, will their specific doctor that they've been going to for years, will they still be able to go to that same doctor? Can you address that?
In all likelihood, your current physician, you'll be able to continue with. There would be very few exceptions to that. We will be providing information as part of the open enrollments process. You'll literally be able to go out onto the microsite and make certain that your physician is still there. But as you think about here at University Park, the physicians that are part of Penn State Health, Mount Nittany, and Geisinger will continue to be part of the network. And as you look across the Commonwealth, I think our employees and dependents out there will similarly find that the vast majority of physicians that they currently seek services from, if they're in network today, the high likelihood is they'll be in network after January the 1st.
Sometimes you may find that your particular physician is not currently part of Aetna, but we can assure you that Aetna is doing a full court press to reach out to physicians who serve large numbers of Penn State employees who are not in their network to try to entice them with a good contract into the network.
And is it a similar situation with the prescription benefits?
It is. There will be many outlets. One thing we heard from employees initially when they heard about CVS Caremark being awarded the prescription benefits program management function, there was concern, does this mean I will only be able to get my prescriptions filled at a CVS pharmacy? That is not the case. You'll continue to be able to access most of the large third-party pharmacies, Target, Walmart, Wegmans, and many others, both here in this area and throughout the state. So it does not imply for a minute that somebody needs to have his or her prescription filled at CVS. I should also mention, for those of you that are here in the University Park area, University Health Services Pharmacy will also be an outlet that you can continue to use to access your prescription medications.
And what kind of tools do people have to check on those specific doctors and those specific prescriptions to ensure that, to find out if the new plan does in fact cover them?
Well, I think the information on Aetna is already out on our openenrollment.psu.edu website, and I believe the information for CVS Caremark is coming around the middle of October.
One of the things that a lot of people have expressed concern over is potential changes to the Affordable Care Act. And this was a concern at the last town hall, and there still hasn't been any resolution in that regard. What can you say to the people here at Penn State to sort of allay their fears of that? Changing anything for them?
Well, the principal thing I would say is that the university remains strongly committed to a very high quality, cost-effective program of medical insurance benefits for our employees and their dependents, irrespective of what may happen at the federal level. So that commitment is really strong and unwavering. As we've all seen, it seems as though the federal government, the Congress, is virtually unable to move through this issue. So I don't think there's any immediacy to the concern there. But just know that we track this very, very closely, and that we will be sure that no matter what changes may issue forth from Washington, that we will do our level best to make sure that our programs are there for our employees and their dependents just as they are today.
Yeah, basically, it's our job is to navigate that uncertain and changing external environment on your behalf, and ensure that your interests are protected through the programs that we offer, and that is an absolute priority for us. Not saying it's easy, but it is a priority for us.
A lot of people are concerned about just the bottom line. What is this going to mean as far as their out-of-pocket expenses, their co-pays, and their deductibles? Is there going to be any great changes there?
There will not be. There will be some minor adjustments. One of the things you'll recall me having said in the past, and other senior administrators, is the university is committed to a 75-25 cost-sharing ratio between the university and its employees. If anything, we are actually sharpening our focus on that, and we will make sure that the two plan options, both the PPO plan as well as the PPO savings plan, will be premised on that 75-25 cost-sharing model. That hasn't always been perfectly the case across both. It's been true in general, but we are now going to make certain that that's the case with respect to both plans. And we'll be making some relatively minor, modest tweaks and adjustments to get us there. But that commitment, again, of 75-25 remains an absolute solid commitment on the part of the university.
To my earlier comment, I would just add to David's remarks that Aetna is the third-party administrator. The decisions about the 75-25 split and how benefits are allocated are made by the university. Aetna is our partner in implementing those, but these are decisions that are made by us with full consultation across all of our constituencies.
And these past several years, we've been using a very highly effective cross-functional healthcare advisory committee, which is populated and inclusive of not only university administrators that are experts in this area, but also our health policy faculty. We have faculty insurance experts and representation from the Faculty Senate, from the Joint Committee on Insurance and Benefits, as well as the Faculty Senate Benefits Committee. So there's broad-based input from from really all corners of our employee base to make sure that as the administration considers changes and adjustments to the program, that we're thinking through all of this very carefully in terms of all the ramifications. We recognize its importance to our employees.
And there is a lot of concern with the amount of change going on, especially right now. A lot of things seem to be landing at once. What kind of resources are there for employees as they go through this open enrollment process so that they ensure that they're doing it correctly?
Well, in addition to the microsite, we'll be offering webinars at various dates and times for people to take advantage of. We also encourage people, if they have questions that aren't answered either by the microsite or the webinars, to contact their HR strategic partner in their college or business unit and raise questions with them. We also have phone numbers for our benefits staff in OHR, as well as an email address that's available on the microsite. So you can get your questions answered throughout the week on the phone, anytime, 24/7 on the microsite or by email. So we're trying to provide a number of different avenues for folks to get their questions answered.
And a lot of times, someone's medical history might be very, very specific, and a website wouldn't be able to answer those specific things, and the people on those hotlines and those emails will be able to help them with the specifics?
Absolutely. If there is a specific individual concern that isn't answered by the sort of generalized information that's available publicly, we'll make sure that one of our benefit specialists is able to address those questions.
That's not to take away from the need that some people may have to have conversations with their physicians, because there is a change, the context is a little bit different, and at the end of the day, it is between you and your health provider how you best manage your personal health. And so sometimes I think the best option would be for you to have a conversation with your physician about the detailed specifics.
And one question that's been raised that we've gotten from online, people have asked all this information that we've been giving to Highmark over the years. They've got a lot of my sensitive information, my Social Security, my medical history. What would you say to them to say, yes, that information is protected and it's not going to fall into the wrong hands?
The provisions of the federal HIPAA law will continue to pertain to all of that information. So Highmark will continue to need to be compliant and will be compliant with the HIPAA law that absolutely assures patient confidentiality, that all of that personal health information is retained in a secure fashion and is not disclosed without the express permission of the individual.
And the university is confident that those websites and programs are secure?
Yes, we are.
And you had mentioned speaking with your doctor. What if I am on a specialized medication and I'm concerned that this isn't going to carry over? What kind of a conversation would you recommend I be having or resources to look at?
Well, you should first, as Nick suggested, consult your family physician. You should also check with the CVS Caremark website that will be up in the middle of October, as I mentioned previously. The formulary will be posted, and you and your physician can work through that to make sure that the medication that you require is covered. If your current medication is not covered, your physician should be able to work through either an equivalent medication that will address your particular situation or condition, or seek to make enter an appeal on your behalf for allowance of that medication if it isn't on the formulary.
And what about people who have surgeries scheduled that would be occurring after January? A lot of these surgeries are booked way in advance, but they've done this through Highmark. Are they still going to be able to complete those?
I would think they should be able to complete those. Again, the key is to contact your physician, whoever the surgeon may be, and just make absolutely certain that that you've double-checked on that particular surgical appointment, and that everybody is aware of your plans in that respect. And one other thing we just asked is, has the maximum out-of-pocket on the PPO plan always been higher in the higher deductible plan? And there's some confusion there on why there would be increased financial risk. Repeat that question for me, Ben. Has the maximum out-of-pocket on PPO always been higher than the higher deductible plan? And they're trying to understand why there's a greater financial risk in one versus the other. Well, it's the structure of the two plan options. It's just sort of the inherent difference between the two plans and an individual employee's appetite to assume risk. The high deductible plan does entail taking an employee and their dependents taking on some greater modicum of risk. As we have really run the numbers through our population, the way it works out is actually over 90% of our employees would be benefited by the high deductible plan from an economic point of view. But everybody's situation is different. Folks with pre-existing conditions, for instance, may feel more comfortable and have a lower risk tolerance, and that PPO plan is still there for them as a choice. So again, it really involves an individual's own calculation with their family about what their risk appetite may be, and then choosing accordingly. You mentioned
it's a little bit like the options that you have with auto insurance, that you can elect to take more of the risk yourself or less of the risk yourself. If you take more of the risk yourself, you'll probably pay a lower premium, but have a higher deductible, and you are then making the decision that you will pay that higher deductible if something happens. And over time, for example, when my daughters became teenage drivers, I changed my risk tolerance. Can't imagine why, but I did. And that option is available to our employees as well, that you can be in one plan if it suits you for that moment in your life, but if you need to change either to or back to the other plan, you're able to do so.
Yeah, you're only making a commitment for a year. You can always, you always have the option to switch.
So if you have felt that you didn't get the benefits you wanted, you could try the other plan?
Precisely.
You mentioned pre-existing conditions a moment ago. Is there any chance that with this new switch that if I have a pre-existing condition, I will be denied?
No, none whatsoever. Categorically, no.
Best answers we have, right? Now, this has been an ongoing question throughout our various town halls, and there was, at the last town hall, you said that there was a change coming in regards to maternity benefits. Is that going to show up in this open enrollment period?
Yes, actually, effective in January, we will be offering a short-term disability program. It'll be voluntary, but it will help, for somebody that may have that circumstances where they need some additional family leave. They will be able to avail themselves of that short-term disability benefit program, and it will provide coverage for pregnancies and family leave, for things of that nature.
And if short-term disability, could you just explain generally what that means to the person who would be applying for it?
Yeah, short-term disability insurance is coverage for a period of a limited and sort of well-defined duration. Greg, help me out. What's the number of months of coverage under short-term? 6 months? So anything longer than that would be considered long-term disability, and if you have concerns about that, then you would want to explore long-term disability insurance options, but short-term coverage for up to 6 months.
The rec hall facilities, can you explain to us what's going on there?
Okay, David, you want me to take, you need a break.
Take a crack.
I think.
Yeah, I need a drink.
So I'll give a slightly longer response than you might like, but I think it's important to have the context. A number of years ago, up to about, I think, four years ago perhaps, the recreation facilities were administered as part of intercollegiate athletics. And that, of course, worked very well for some of the facilities which were shared facilities. You're familiar with some of these, like White and Rec Hall, where intercollegiate teams use them, and students, faculty, staff use them as well. A decision was made by President Erickson, actually, in response to concerns that had been expressed fairly broadly about access to recreation facilities and the concerns as to whether intercollegiate athletics really had the right focus on campus recreation that it should have. Decision was made to pull recreational facilities out of the purview of intercollegiate athletics to somewhere else. And the somewhere else was student affairs, because the big number of users of recreation facilities are our students. So that was sort of the logical place to put it. As we've absorbed campus recreation into student affairs, a number of changes have been made. I think most of you are familiar with the fact now that students don't pay a separate fee. They pay as part of their overall fees that they pay every semester. Now every student has access to recreational facilities. But as we effected this transition from ICA management to student affairs management, there was some complexity, and probably Rec Hall is a good place to point where the complexity was considerable because of the intertwinement of the facilities. It became very difficult to meet our security obligations as well as provide access. So that created some challenges in that transition. Two things have happened, not to be mixed again. One is that as the students have moved to paying for their access to recreation facilities through their fee, so too have we introduced a fee. I think it works out to be about $18 a month for faculty and staff for access to recreation facilities. And this reflects the fact that no longer was this just covered by within the intercollegiate athletics budget, but there is a cost associated with providing the facilities, to maintaining them, to upgrading them. As you can imagine, our exercise equipment gets a lot of use and needs to be upgraded on a regular basis. So decision was made that faculty and staff who use rec facilities would need to pay a modest fee. It's about half the prevailing rate of external gyms. Also, in the post-2011 era, there was a decision made to limit access to recreational facilities for people who are outside of Penn State, read members of the community. That has actually been relaxed recently, and there is a pilot program underway that, under certain conditions, allows access to members of the community again. They have to pay, and they have to pay considerably more than faculty and staff do, but we're piloting that to see how that works. Now, getting back to Rec Hall specifically, I know there's been a lot of concern expressed about Rec Hall, and there were what I would characterize as probably some premature communications that went out about the status of Rec Hall. We know it's a special facility, and the things like the track and the squash courts and the showers that the running groups like to use all make Rec Hall kind of odd. And sort of the one-size-fits-all approach to Rec Hall, we simply know is not going to work. These early communications came out, I think, that clouded the situation a little bit, but as of today, Rec Hall is still accessible to people who've paid the recreation fee, and we are working on a more reasonable and workable access protocol for Rec Hall for faculty and staff. I think there was concern that that was going away completely. That is not going to happen. We don't have all of the details worked out yet, but we will, and we will communicate them very soon. So Rec Hall continues to be accessible, and moving forward, it will be accessible. We just need to figure out the mechanism to make it work in this new environment that we have. Sorry, that was a very long explanation, I know, but...
Along the lines of exercising facilities, under the old Highmark plan, you could pay a fee and then go to various gyms in the regional area. If you were signed up for that, what happens to you now?
I believe there's still going to be options available for discounted rates at a number of different commercial gym facilities. And people should, again, check the website out. There will be names listed there, but that will still be accessible.
And I can add that if you signed up for the Highmark sponsored plan, you are in, and you can continue to be in, even though we're moving away from Highmark, because it was a plan that you had access to through Highmark. So the fact that we're moving to Aetna doesn't mean that you've lost access if you've signed up already, and I hope many of you took the opportunity and did that.
We had a question come in from the audience about HSAs, and if they had money still in the old plan, what happens to it?
That money will be rolled over. In fact, I think, Greg, it's already moved to another plan administrator, so that money is absolutely there for you. It is, they are your assets, and they are completely portable and will be usable in the new, with the new plan administrator.
And on sort of the other end of the spectrum, if someone has worked pretty close to a lifetime cap on the benefits, I know there was a question about dental, will that money that they've put into the system be reset, or do they get to pick up where they left off?
I don't believe it will be reset. I believe if they've hit their cap, they're there.
We had a follow-up question when we were talking about our medical records beforehand, and this person wanted to know, will that past information still be available to them if they need to go back and look at something?
We will find out the answer to that question. That will be something, Ben, that we can provide as a follow-up. I don't want to give misinformation, so we'll need to check on that.
And just as an aside, a lot of these follow-up questions we will, get to you in various forms, possibly through Penn State Today, any of the lingering questions that we need to get answered.
Just to set people's minds at rest, it's probably highly likely that the answer is yes, because the notion that changing TPAs would mean that all of your prior medical history is erased, likelihood of that is pretty darn low. So
It's with your doctor.
right.
Fundamentally, so
I
there's
think
that-
you
there's
can
that.
probably be assured that you will have access.
Now, this isn't the only change that's coming right now. There is some changes coming to what was ESSEC, what's now going to be something new. So can you tell us a little bit about that?
Sorry, it changed from which to which?
Tell us about the new system for people to be inputting their vacation time to their portal.
Sure. Thank you. Hearing issues. Workday is coming in December, and that obviously will be our new HR payroll platform that will be accessible to all employees for them to enter their time, for them to get payroll information, for them to indicate if there's been any change in their withholdings or other personal information, emergency contact information and the like that they would care to enter in. So that particular system will start to roll out in December, be fully accessible in January, and so yes, that will be a new system that will touch all employees, all faculty and staff here at the university.
And why was a change needed to that system as well?
Well, as with our other core systems, our student information system, our finance system, they were built on homegrown legacy code that is now 30 plus years old. And quite simply no longer meets the business needs of this very dynamic, large, and diverse institution. You can imagine that that homegrown application code that supports our finance system, our HR system, and our students, and formerly our student system, they never thought about smartphones, web access, mobility, things of that nature. So these contemporary applications, like the Workday application, are built for the web and for mobility from the ground floor up. So I think that all of our stakeholders will find them to be much more approachable, much more user-friendly, easier to get at the information that you need to conduct your business with the university in an effective and rapid way. So this is just simply a sign of the changing times. In fact, Penn State, to my knowledge, among major public and private research universities, is probably about the last to make this transition to new vended information systems.
I would add to David's comments, there's also a very practical consideration also, and that is that these enterprise-wide systems that we've been using for many decades were written in a language for which we can no longer find programmers. So that is a very practical challenge, because it means if something breaks, we're running out of people who know how to fix it, because most of them have retired by now. Or, more importantly, and to David's point about how rapidly things are changing, as new requirements come down, as modifications need to be made to these systems to enable us to respond to maybe regulatory or reporting requirements, or even our own internal uses, we just don't have the people anymore who can program those modifications into the systems. And so the state-of-the-art approach to this is to move away from those homegrown systems for which you cannot find support, to the vended systems where support is basically guaranteed, along with upgrades and flexibility.
And will there be time and opportunity for people to train on those new systems as well?
Absolutely. Yeah, I think the training for Workday will start to roll out in next month, in fact. So there will be plenty of opportunities for all of us to get acclimated to the new system, to take advantage of the training, web-based training opportunities, so that we're familiar and ready to hit the ground running when the new system rolls out in a few months.
A very specific question: will we all be paid with the same frequency at the same time as it was before?
Absolutely, yes.
So
no changes to if you're currently a monthly employee, that will remain biweekly. Your frequency of pay won't change at all with the new system.
And hopefully the same amount too.
Speaking of payment schedules, we've had several questions come in. If you could explain what is happening with what was known as HR 88.
Yes, HR 88 has been superseded by HR 105, and that's the new applicable policy for employees who work less than 100% time. And so I would encourage everybody to, to check into the applicable policy, which is now HR 105, and work through with your supervisor if you have any questions about its relevance to you. But it is actually something that is there to assure that we are compliant with state law. And so again, it continues to be an option that the university and supervisors can take advantage of for particular situations in which an individual needs to or wishes to work less than full-time.
And it's important to note, to David's point, that this is not so much an issue of transitioning to work lion. It is actually a regulatory requirement that we are obligated to pay employees within a certain time period of them earning that compensation. And so the way we were doing things was actually really out of compliance. And so this transition has been the opportunity we've taken advantage of to correct that.
So people who are unhappy that they had it spread out over 12 months for them, and it's now to 10 months, there's really nothing that can be done about that.
It's a state legal compliance situation.
Jumping off of the earlier maternity question, we had one come in. Would the Penn State ever consider a paternity similar situation?
That's a more complex question. I think we try to be supportive in situations where families have special needs or difficult transitions. That specific question, I think, as we've said before about the maternity leave, we'll probably have to think about a little bit, but I'm actually not surprised that we got that question, given that we've moved on the other one.
We had a question come in from the audience, going back to Aetna. Will there be a similar program for a spousal surcharge if the family looks at the coverage and says, this new Penn State through Aetna coverage is better than my spouse would receive through their benefits? Can they still then accept Penn State benefits instead?
I don't believe there are any plans to modify the spousal surcharge.
Thank you. Another question coming in, also related to spouses, as to what the spouse, if two spouses work here at Penn State, how is it determined as to what income range the insurance benefits are based off of, one or the other?
It's the higher of the two spouses. The higher income of the two spouses is the one upon which the premiums will be predicated.
And why was that decision made?
It's actually a prevailing practice in other institutions, and it simply seems to us to be the fairest way to apportion and spread the costs of maintaining a high quality health care program.
In other similar questions that we received in the past, you've answered that if you were to base it on the lower person's rate, then it would increase the rates for everyone overall in the long run. Is that a similar situation?
That's correct. It's an equity. It really comes down to, I think, a question of sort of fundamental equity and a person's ability to pay. And obviously, our health plan at Penn State is and will continue to be somewhat indexed to salaries, and that's based upon, I think, just a general awareness of equity and fairness, and somebody at a higher income has a relatively higher capacity to absorb the costs of their particular care. So obviously then it would stand to reason that we would want to track to the income of the higher earning spouse.
Thank you. We had a couple of questions come in about people who are concerned that they're hearing from their doctors that they might not like the Aetna plans for various reasons, about how does Aetna decide what doctor reimbursements are, and what sort of recourse do people have there?
Well, I think obviously we always open a door to appeals on the part of employees or dependents about their particular care requirements. I don't think there will be anything substantially different that they'll find as we move from Highmark to Aetna. But again, there will be that appellate route that if somebody does not feel that they're being treated fairly or properly with a particular finding about an allowance for a condition or a treatment, then they will simply need to follow the appeal procedure that we've already determined.
Going back to open enrollment, we've had some people say that in the past they've just sort of, not done anything and they've been able to stay in the same plan. What's going to happen now? I mean, is there going to be that option to where they just kind of roll into something similar, or are they going to have to go step by step?
I believe they'll need to make an affirmative choice of no, check that. They will have they will be able to just roll into the same plan from one year to the next, with the exception of the spending accounts. Thank you, Greg.
That said, we always do encourage everybody every year not to just roll, but every year to take a good hard look at what the options are, because your circumstances may change. And I think you may find that as you transition through life that one plan may be better than another. So we absolutely encourage you to have a good hard look every year.
One of the things I wish people would take more advantage of are the calculator tools that we make available to employees, where you can run scenarios based upon your own family's or your own individual health experience and compare and contrast between the two plans and actually get a very good individualized handle on which may work more to your advantage. We wish that more folks would take advantage of those. I think they would be extremely beneficial. They do take a little bit of time, obviously. There's some data input required to do that well, but I think that the information you'll derive from that will help you to make a more customized choice to your particular situation.
Another very specific question. When we switched to this new plan, several years ago there was a tobacco surcharge. Is that going to come back in any of these new plans?
I don't believe we plan to continue the tobacco surcharge, so that is going away. I would stress, however, that the university, I think, is seriously considering the output from a tobacco task force. Smoke-free campus is something that we continue to be very, very interested in. The obvious health benefits to be gained from smoking cessation continue to be very tangible, and we will very, very, I think, strongly continue down that path of trying to encourage all of our community, students, faculty, staff, dependents, to avoid tobacco use, and if there are already users, to seek help and the support they can get from us for cessation.
And are there going to be any programs in this new coverage that reward you for healthy behavior or healthy choices?
Well, I think the best reward for healthy behavior is the most obvious one, which is lower utilization of healthcare needs. Obviously, we want people to continue to take advantage of preventive examinations, annual physicals, and things of that nature. But if you are engaging in healthy behaviors, I can't imagine a more potent incentive than just simply the fact that the statistical likelihood is you're not going to need to access your physician nearly as often as those who may be engaging in less healthy behaviors or are not keeping themselves physically fit or watching their diet and so forth.
Another question from the audience today. You mentioned the VRP and the savings recouped from that. Are there plans to do another form of that a couple years down the line?
We don't have any plans at the moment that I'm aware of. We would probably never say never, but there are no imminent or emerging plans around another VRP anytime in the foreseeable future.
Yeah, I would say no.
Could you gave us some numbers earlier, but can you tell us the benefits of that and what has happened since then from the voluntary retirement?
Yeah, so 587 of our colleagues took advantage of that program and went out either last December 31st or this June 30th. By our latest calculations, the savings to the university from that the recurring savings are about $14.4 million, which is substantial. We're obviously still working through some decisions about backfilling in certain positions. Now, in the case of faculty, and Nick can speak more to this, I believe faculty generally have been replaced almost one for one. However, if you think about the economic benefits to the university of a tenure track assistant professor coming in at a much lower rate than the person he or she is replacing, then there are still, even in that scenario of replacement, substantial savings that the university can pick up, as well as some academic benefits you may want to speak to, Nick.
Yep. What David said is absolutely true at University Park. If we look across the entire university and consider the campuses as well, we actually did replace the faculty departures with fewer reappointments. All of these, whether it's faculty or staff, actually were all of the replacements were part of a plan that was submitted by every dean and every chancellor and reviewed by David and me to ensure that this was being implemented in the right way. And we certainly supported the rehiring of critical areas. The opportunity that many deans and chancellors took, as David alluded to, is to, in areas where there is relatively little interest or need anymore. Some of those areas were not refilled, but instead investments made in other areas where there's growing student interest or research opportunity. And so that was something that we very much tried to take advantage of strategically through the rehire process.
You mentioned the budget impasse earlier and how we're still waiting to hear from that. Some people are, very concerned that that ties into their raises and that some of those aren't keeping up with the cost of inflation. Is there ever been any consideration to a increase for people making under a certain threshold, say under $50,000, that would help them keep up with the pace of inflation? Would that be
a differentiated rate?
I'm sorry, what?
A differential rate? Is that
yes.
what you're? To my knowledge, no. I think we may be open to any number of things in the future, but obviously with the appropriation status, what it is, and even if, as we all hope and expect, that we do receive the appropriation from the state this fiscal year, I think the trend line on state support, sadly, is very clear. We are receiving less. We received less last year than we did by far 20 years ago. Even though we're educating more students and doing much more, it has not come anywhere close to keeping pace with inflation. So we have some very difficult challenges. We are, at the core of it, a tuition-dependent university, probably one of the top 2 or 3 most tuition-dependent public research universities in the nation. That's not a distinction that we're particularly happy with or proud of, but it is the reality of the fact that we're also about the 47th lowest funded out of the 50 states. So the math actually is relatively simple and straightforward. We obviously hope that changes, but we are doing our level best, and this is a difficult dilemma that Nick and Dr. Barron and I and others wrestle with literally every week. We've got tremendous concerns about the maintenance of affordability and access for our students. Again, because we do have among the highest tuition rates in the nation. We want to keep the lid on that to the maximum extent possible, but yet still provide the resources necessary to maintain a world-class research institution. This is a really difficult challenge for us to solve. Just know that we work on it literally day by day, The Board of Trustees is extremely concerned about it and has just launched an accessibility and access and affordability task force that's looking into this very same set of difficult and complex challenges that we're facing. But we'll be looking at any number of techniques in the future to help us really grapple with this funding scenario, because it continues to, I think, be one of the foremost points of concern for the university administration and the Board of Trustees.
Maybe I can approach this from a slightly different perspective too. There are really, I would say, 4 core ways that employees can look to increase their compensation. A couple of them they control, and a couple of them are sort of more externally driven. The 2 that are externally driven are market. What does the market pay for the position you occupy? And then there's equity, which is really controlled within the university. We try to ensure that people who are in a particular position at a particular level are paid equitably across the university. Now, all of you may have examples of instances where you've observed that not to be the case, but I can assure you that is something that we take seriously and we're working on. I will say, though, getting back to the other 2, that the days of cost of living increases that we used to think of, those days are pretty much behind us now. We provide a general salary increase pool every year. This year, as I think everybody knows, the amount was 2%. That 2% is to be allocated by merit. It doesn't mean that everybody gets 2%. It means that some people get less than 2% and others get more than 2%. The ones who get more than 2%, that is determined by performance. And that is one thing that over the last 5 years or so we've worked very hard as an institution to focus on, and that is to couple increases in compensation through general salary increase with performance. So merit increases go with performance. So we're trying to get away from sort of just the notion of cost of living increase. And then the 4th one I would say, and then back to David, is that Penn State is an amazing institution in terms of the career opportunities that exist for our employees. If you stay in the same position for an extended period of time, you may limit the options that are available to you. So we have lots of training available, lots of support for people who are looking to really advance their career into different and take advantage of different opportunities. And we certainly encourage everybody to do that. We don't want you to all go out and do it tomorrow at the same time, but there are really great opportunities at this institution for you to chart a career course and receive increased compensation as a result of doing that. So there are there are lots of knobs to turn. The one knob that we don't turn so much anymore is the notion of the cost of living increase. That's something that we really don't do that much anymore.
The only thing I would add to what Nick has said is pertinent in particular to our technical service employees, who obviously are bound by a contract that's negotiated between the university and the Teamsters International. So that's a slightly different scenario for that large number of employees.
Thank you. And going back to the insurance, we had a question come in from the audience. Will the change to Aetna affect the intention to carry insurance into retirement, maybe those people who are closer to the end of their career here at Penn State?
No, the retirement health program will continue as is.
Thank you. We had a question come in. Short-term and long-term disability is important for single employees, maybe even more than life insurance, because they do not have a beneficiary designated. So are there any thoughts that you would like to share on this benefit category?
Well, I think obviously we want to provide a balanced sort of portfolio of options for our employees, and so I think we can certainly discuss changes to that, but what we try to do is offer some choices and some options. Obviously some aspects of our benefits program are mandatory and provided across the board. Others are voluntary benefits that employees can opt into at their own discretion, and we are always in conversation about how we change those up and what things are of greatest interest and value to our employees. And the short-term disability now is actually an example of something that we've added to that portfolio of offerings for next year.
And when does someone need to sign up for the short-term disability? Is that something that if they have something later on down the line, or does that need to happen at open enrollment?
I assume they'd sign up in January, or open enrollment. Open enrollment, so actually November 1 through 17 during the open enrollment period.
Now, here's a popular question. What's going to happen to the money that the university is saving with this new plan?
Well, the money that the university is saving in the new plan is actually money that we very badly need to save again to address the imperative to keep our educational costs affordable, to allow us to make investments in our facilities. You heard me at the top of the hour allude to the new $4.7 billion capital plan that will take effect next July. These are resources that we will need to come up with, and we are going to need literally every nickel of those savings to address the needs for refurbishment of our facilities, to keep up with the scientific equipment demands of our faculty and students. So we will have no end of a very lengthy list of priorities that we will be able to address through those savings. In fact, we would need a whole lot more savings than what we're actually going to be generating to fulfill all the demands that are coming at us.
I would add also, David gave that very scary number earlier in the town hall of 14% increase in healthcare costs year over year. One of the things that the savings help us with is bringing that increase down. So there's still likely be an increase. It just won't be as much because we're stewarding the process a little better. And the question was asked about salary increases, and I would just say too that we are committed over the long haul to continuing to ensure that our staff and faculty are compensated competitively and fairly for their work. And it's hard to do that every year with all of the challenges that we have on budget. So every opportunity that we have to extract savings as an institution increases our ability to make investments in our people in other ways. We would much rather see you have the money in your pockets directly than paying much higher prices for a third-party administrator, for example. That is something that you don't necessarily benefit from directly at all.
Here's a question that was sparked from something you were talking about earlier with the Tobacco Task Force. As far as you know, is this going to include other forms of smokeless tobacco or new things like e-cigarettes and vaporizers?
As far as I know, it's comprehensive and is inclusive of all different forms of tobacco usage.
And is there any indication on when we're going to hear from what these recommendations might be?
It's soon, I think.
Very soon.
We're going through the task force has reported out, and I think we're just going through the process of reviewing the recommendations with a view to implementation. So it's relatively soon. Don't know the exact target date offhand.
Have there been any discussions about long-term care plans with this new program?
I don't believe we have any plans for long-term care insurance at this time. I can make a general comment that many long-term care insurers have dropped out of the market because of the cost and the difficulties of underwriting that particular form of insurance. It's obviously extraordinarily costly, and insurers have found that it's not a particularly profitable line. So there are fewer and fewer options for long-term care insurance, and the costs of that insurance has grown progressively higher. So it's probably not something that you'll see the university address anytime soon, even as I can say we all as individuals recognize that's something important that we all need to be cognizant of, saving for, et cetera, for that eventuality. But there are relatively few cost-effective options for it, sadly.
Okay, questions are starting to slow down a little bit, so I wanted to ask you just sort of an overview statement. What would you say to people just in general who have this sort of change fatigue and are scared about everything that's changing all at once here at the university?
I would say to hang in there with us, that for Penn State to maintain its edge as a leading global research institution, change is unavoidable. It is something that to the maximum extent we need to embrace. We will try to do our best to sequence it in such a way that it doesn't, become like a tsunami that threatens to submerge us. In fact, even as we think about the change in our enterprise business systems, we have tried to do it rather than some institutions that have gone more with what's called the Big Bang approach, where they do it all at once and try to get it over with quickly. We've tried to sequence it in a way that our community can absorb so that it is not as overwhelming. But the nature of the world that we're facing is one of very dynamic and turbulent change, and we just need to, I think, accommodate ourselves to some extent to that, and just trust that the administration, working with the Board of Trustees, will do its very best to make sure that we do this in a very thoughtful way, that we don't ask people to absorb more than they're capable of taking on. But yet change is the one sort of constant in life, and if we're going to maintain ourselves as a research university of premier stature, it's just something we have to accommodate ourselves to.
Yeah, I would just echo everything that David said, but also just say that we really, as we go through this, we really value your input. I think we work very, very hard to ensure that these changes descend upon the university with in the smoothest possible way. Number one, that's just hard because they're big and they are going to impact everybody. But number two, it never goes perfectly. We have meetings and meetings and meetings and then more meetings to try to figure out every last little thing that could go wrong, try to resolve it in advance, but there are always surprises because these are big and complicated. One of the most important things that you can do to help us with that change and help you with that change is if there are things that are not working well or things that look a little bit wacky or don't seem to make sense, we need to hear about them from you, and we will listen. Because 9 times out of 10, when we get a suggestion or an observation or a critique from you, we can actually turn that into something actionable and make adjustments to make things better. So be part of this process. Saying embrace it is probably, we're in a time of change fatigue is a little tough, but just get in there, roll up your sleeves, and make sure we're hearing about things that that can be done better, because we listen and we want to put your suggestions to work.
And just one final thing, a lot of the questions that were coming in are very hyper-specific to people's situations. If you could remind people the resources that they could go to get answers to those very specific to their healthcare, to their prescription questions.
Sure, happy to do that. Particularly in the benefit space, if you go to openenrollment.psu.edu, you will find a bevy of information there about the benefit plans, about the changes with Aetna and CVS Caremark, and you'll also see a lot of contact information, ways in which you can get particular questions that may be unique to your circumstances addressed in a quick and responsive way, and would highly encourage everybody to take advantage, even if you don't plan to make any significant changes. Inform yourselves about the changes that are coming, and I think it will put you in a better position, and that's why we make all these good informational resources available to you.
Thank you all for your questions. We're going to end the Q&A period right now. If you'd like to say anything in summation.
Go ahead.
Yes, I appreciate everybody's engagement here this afternoon. It I think, is part of our commitment to you that we made a couple of years ago, really to keep in continuous contact with you, and we think it's very important to continue to support these opportunities to meet with faculty and staff face-to-face, to hear the things that are of interest to you, that are of concern to you, about which you want more information. And again, if there are a couple of questions that we haven't been able to address with precision here this afternoon, we'll push that information out to you in the coming days. But just know that Nick and I plan to continue this series of conversations with you all. You all, after all, after the students, are our most important constituency.
Tonight, as with pretty much every night, I will drive home feeling pretty exhausted after a day in the office where there's been a whole bunch of things that have come our way that one would never have expected. Actually, somebody asked me yesterday if I had reviewed the email that they had sent me the day before. And after I gave them the look, I said, if you could just reach down into Washington, D.C. and hit the pause button down there for maybe 48 hours, then I'd have a much better chance of being able to get to that email in a timely manner. Every day there are things that come our way, both from inside the institution but increasingly outside, that make our jobs very, very interesting. So I drag myself home. But tomorrow morning, when the alarm goes off, I will jump out of bed again and be really excited about coming to work, because this is an amazing institution filled with extraordinary people, serving literally 100,000 students, plus communities all across Pennsylvania and beyond, actually, now through various mechanisms. That's why I'm excited to get up every day and come to work at Penn State. And I hope that most of you feel the same way about what you are doing as well. We all have our spaces where we work. We all have our responsibilities. The fact that all of you and so many of your peers and colleagues are doing that with determination and great commitment to advancing the mission of this university is really amazing. It's working. This institution has an incredible brand and reputation, and so this is also an opportunity for us to thank you for what you do every day in what you do to make this the great institution that it is. So thank you for coming to the town hall, but most importantly, thank you all for everything that you do for Penn State. It's really a pleasure to have the opportunity for us to serve you, and we're committed to doing that. So thank you.